cover updates to local health officer orders. Today's lineup includes Health Officer Ellen Leahy, Shannon Terrio, who's the Director of Environmental Health, and Cindy Farr, who's our Incident Commander. At the end of each person's chance to speak, we will open it up for questions from our members of the press. Please mute your mics until that point so that we don't have as much background noise. And with that, I will turn it over to our Health Officer, Ellen Leahy.
Thank you. Ellen Leahy, I'm Director and Health Officer from Missoula City County Health Department. As the local health officer, I do have the statutory duty and responsibility to protect the public health and specifically to take steps to limit contact between people in order to protect the public health and to control communicable disease. So those are some of our oldest and clearest mandates in public health. 2 weeks ago, when the governor reopened, went into phase 1 for the state of Montana, he recognized and endorsed the idea that the statutes do allow for different counties to create more stringent restrictions. And in large counties, that is sometimes the case. In Missoula County, at the time of reopen, we had a number of situations still at play. While we were not the county that has had the highest number of historical cases, when we make a decision to reopen, we look at the data at the time. So in the phasing process, you look at the data, then you watch it for at least 2 weeks, because that is the incubation period for this particular disease. So it can hide, not be visible for at least 2 weeks. And then look at the data again as you move through the phases. At that time, Missoula County had the second highest number of active cases of COVID, which was 9. And we did not have adequate testing capability to understand if we had more cases that could not make it through the screening process. We had just started opening to screening for all symptoms. Since that time, we had originally 3 symptoms to use in our screening. The CDC has added 9. So that opens our screening even wider. And we have received more screening materials in that time. So the trends in disease have improved. The trends in testing capability have improved. And in these 2 weeks, I've had the opportunity to get a lot of good pragmatic advice from folks that work in the different industries that are affected. Guidance is one thing. Knowing how to implement it safely in your own business is another task. So at that time, I delayed the opening of salons, barbers, estheticians, the types of personal care that in order to provide that care, you have to be within the 6-foot contagion zone. So I saw that as an important in that situation to take more time with that. We have put together, with help from experts in the industry, some more requirements to help mitigate that risk that does exist in that 6-foot zone, and a nice long list of good recommendations from people that actually are involved in those practices. So we will require a short, pretty simple plan from each business about how they're going to implement the guidelines, because the businesses between massage therapy, a barber shop, esthetician, waxing, simple haircut, they're very, very different and they're laid out differently. And so we will request that plan. They do not have to turn it in, but we do want them to have it on hand. That way, if we get a complaint, we're able to talk to the business. If that's in place and they've been able to train their employees about what the symptoms are and have a plan for not coming to work, they can open effective Monday, May 11th. So I want to thank everyone for their cooperation and their assistance to get us to that point. The second change that I've made, we started with a very small group limit and that was 25 group limit, and that was 25 people with social distancing, 6-foot limit. Missoula has a large number of local events, particularly in the summer. I've increased that limit to 50, but it still does require social distancing. And these are for things like little, small sporting events, small craft fairs, things like that. You still have to have that social distancing. Keep in mind that the governor, again, still has us in phase 1. And so it's only in cases where you can't have social distancing that groups could be as large as 10, but that's not recommended. So we've opened that up a little, and I'll be working with and I already am working with the Missoula Reopen work group about how we can better assess all the different varieties of activities we have in the summer, which can continue and in what ways they can safely continue or not. The third change in this order is farmers markets. We've defined farmers markets as a non-social event that is largely about the sale of unprocessed agricultural products. And I know when you think of farmers markets, you think of all the fun and the gathering, but unfortunately that is exactly what we can't have during a time of a pandemic. And the sellers very responsibly recognize that, but we all want the produce to get from our local producers to our local folks. So with a similar plan for 6-foot distancing, farmers markets can be as large as 250 people at any given time. I don't know that we'll see that happen, but keep in mind that that 250 includes counting all the various vendors that we often see. So they will be able to open with their plan by May 23rd. Next, I have looked at school graduations, and I know it's been a very difficult year for all schools, and there is trepidation, but there's planning to help schools reopen next year, and we're going to take full advantage of the summer to work with our schools and do that. I know that the seniors have lost out on a number of traditional activities, and I still have to look at the fact, however, that we are in phase 1 in Montana, and even though our numbers for active cases are down and that looks good, graduation is 3 to 4 weeks out. I do not know where we will be 3 or 4 weeks out. And with the slow gradual opening that we're trying to do and the sacrifice that so many businesses and workers and others have made, and the fact that the schools themselves did not reopen for, again, good pragmatic reasons, I am going to limit graduation sizes to 250 with a social distancing plan and work with the schools, with our staff, to help them accomplish that. Large groups are generally the highest risk types of gatherings or business or any type of activity that can occur. And even with precautions, the larger the number, the larger the risk. This is particularly important to consider that the younger age group, 20 and under, can remain asymptomatic and be contagious with the disease. So those and some CDC guidance and the Johns Hopkins guidance for reopening, risk-based guidance and mitigation guidance for large group gatherings is how I arrived at that decision. That is my decision. And I know that I've received messages of cooperation from the affected school districts. But if you're unhappy with the decision, as I manage, I expect some people will be, those calls should come to me. We will work with the schools to do the best we can under those limitations. Governor Bullock yesterday announced the reopening of gyms, fitness studios, some pools, movie theaters. This order is not affecting that that reopen. That arrived late yesterday, and that goes into effect on May 15th. So just to keep things clear, we haven't really studied that reopen guidance yet. I do have a reminder that the extra precautions we put in place for all retail, not just those that were formally considered essential and those that were formally considered non-essential, those distinctions are gone under the governor's directive. But for all retail, to have social distancing plans in place, and we continue to work with those that that we get complaints about or that we get questions from. So those remain in place. These orders will remain in place until they're revoked or revised or the governor issues different guidance. But I do want to remind everyone that in a phased reopening, we are still in phase 1. Thank you.
Thank you, Ellen. Our Environmental Health Director, Shannon Terrio.
Good morning, everyone. Thank you. So I just want to add a few things to what Ellen said, specifically about farmers markets. We worked with both of the farmers markets and the CFAC, Community Food and Agriculture Coalition, on how to connect people with local produce. And we looked at a whole bunch of ideas and threw out a whole bunch of ideas that we felt weren't going to work or they felt weren't going to work. The markets really have done a lot of thinking about how to ensure people can stay 6 feet apart and how they can have heightened crowd control and flow control within the markets and how they can increase sanitation and cleaning. And so we felt like this would be a really good solution so that vendors can connect to people and the produce, the fresh produce and ag products can get to the people who need it. I will say one thing, that the farmers markets require written approval, and so their plan, unlike barbers, unlike retailers, have to be submitted to the City County Health Department for review to the Environmental Health Division in order for them to operate on May 23rd, that Saturday. They will need to get us something by Wednesday, this coming Wednesday. I know that's short, but there needs to be time for some review and back and forth in order to get something in place that will really work. And I also know that at least the larger markets here have done a lot of thinking and are very far kind of progressed in that plan. So we think that that could work. That's the same for graduation ceremonies, except as Ellen said, I think that there's a lot of other planning and discussions that will happen before we see plans for graduation ceremonies. So we appreciate the input. We got a lot of input from barbers and salons and massage therapists about reopening, about delayed reopening and how to reopen safely. Really appreciate that people connected with us about that, about the farmers markets, about their concerns when they see them in the community and their questions. So we're here as a resource and looking forward to this next step in phase 1.
Thank you, Shannon. And Cindy Farr, Incident Commander.
Hi, everybody. I just wanted to add a couple of words to what Ellen and Shannon have already said. And I just want to say thank you to everybody in our Missoula community for really cooperating and doing everything that you can to help us prevent the spread of COVID-19 in our community. It's now more important than ever that we continue those social distancing practices, good hand washing, cloth face coverings. We really want to make sure that we don't see a big spike in cases as we're continuing to move forward in this phased reopening. So thank you to everyone for everything that you've been doing so far, and please continue to be vigilant so that we don't see a big spike in cases.
Great, thank you, Cindy. And now we have a few minutes for some questions from our members of the press.
I'll go first. This is Maritza from NBC Montana. I'm wondering, Ellen, by saying you haven't had a chance to look at the plan yet about gyms and movie theaters, does that mean you guys may make some further decisions on that maybe in the next coming week? And also, how will you manage the 250 capacity number at the Clark Fork Market where so many people come from all different directions?
Well, the Clark Fork Market has already provided us a plan and extensive conversations about how they think they can do that. If the 6-foot distancing, depending on the 250 won't be a goal, it's a limit. If the 6-foot distancing that is needed all the way from any line from people that are trying to enter the market, all the way through among the vendors, one-way walking, those types of things, and then a way to also exit safely without people getting congregated. That is what guides the plan. So the number at any given time may be always less than that, or at any given time less than that. But farmers markets, again, even though ours has taken on a lovely social aspect to it, they really aren't, that's not their primary purpose. And similarly, graduations have other primary purposes that have a lot of social aspects to them. So we did want to go ahead and allow those activities to continue, but in a reduced and much more controlled fashion in order to err on the side of caution.
And so if I could just jump in and add to what Ellen's saying, there are things that are put in place to maybe fewer people will come down to the market. Of course, we want people to go down there to buy produce and buy the agricultural products, but there won't be any prepared food vendors. There won't be music. There won't be kids activities. So it's trying to take the social event part, set that aside, and really focus on the main purpose. And of course, that's not the goal. Eventually, we want to get back to the super cool farmers markets that we have in Missoula all across the county. But that's the place that we need to start in phase 1.
And we also have talked with both high schools and farmers market about there are folks who are in high risk health categories, and the farmers market, first of all, not knowing when and how they could open until we could work through some of these pragmatic aspects of it, have been promoting online sales, pickup and delivery. And so those who still feel like, they are they're in a high risk group, and even with these controls, wish to not be a part of a group like that, these folks are all about getting those vegetables to you. And people that have the SNAP benefits, WIC benefits, those are very important populations to serve. And that will be another activity that's part of the farmers market and caused us to move more quickly to try to find a way to safely open it.
Mm-hmm.
And so will you guys reevaluate the next week, this new order by the governor with the gyms and the movie theaters and stuff?
Yes, we'll take a look at it. We don't tend to get notice of what's coming until actually it's released publicly. So we haven't really had a chance to look at it. We were working to get these reopenings in play.
Hi, Patrick Riley with the Missoulian. A question I have is, will the department be looking at further easing of restrictions at 2 weeks from now? Is this going to become a regular routine from here on out?
I don't know on that, because I don't have, I don't know when the governor's phasing will change. Mm-hmm. Most recently, he moved phase 2 activities such as the gyms into phase 1, and I have to try to understand what is going on there and what might happen next. That said, there are a number of local Missoula activities that don't fit in any category, and the Missoula Reopening Group knows that I do not want to look at those from only a public health perspective, one by one by one by one by one by one by one. And so the Missoula Reopening Working Group has as one of their goals to help us look at things like the city band, the out to lunch, the Thursday night, all those type of things. We have to do that with a number of caveats. The biggest is, it would be wonderful if the disease trends stayed down. It would absolutely be wonderful. But with a 2-week incubation period and having it still on the rise in many parts of the nation, we can't count on that. And our other caveat is we really don't know, and the governor doesn't know, I imagine, when he's going to move us to phase 2. So while we can be a little more cautious and add more mitigation measures that fit our community and our situation, we can't change the phasing.
Mm-hmm. So kind of a follow-up question to that, are there any circumstances under which you might issue an order tightening things back up again?
Yes. If we, and it would be a judgment call, and we would work with our epidemiologists, our infectious disease consultation, and the State Department of Public Health and Human Services to help us make a judgment call about what we are seeing epidemiologically if we do get cases. Why do I say that's a judgment call? Well, we expect to get, it'd be lovely if we don't get a case, but that could also mean that there's cases out there that we're missing. That's a possibility. But with our expanded testing, I'm not going to be shocked to find a case. It's important to find them and to isolate and quarantine. But what if we got a number of cases that don't seem to be connected to each other? That could indicate a new round of community spread, as opposed to a small cluster where they're connected and you can kind of get in there and encircle it. So those are the kinds of things that require the kind of consultation with infectious disease and epidemiological experts, along with our own expertise at the department. Our goal is to avoid that, and that is one of the premises that I have for a slower and much more on the ground pragmatic approach to putting these protective guidance in place, because we don't want to reshutter again.
Ellen, this is Martin Kidston with the Missoula Current. You have said over the last couple of weeks that the health department here in Missoula County hadn't expected the governor's order or something to that effect, and you guys spent the next week reviewing the order because you weren't expecting it to come down. Are you suggesting there's no communication between the governor's office and local health departments in these decisions? That you guys have been totally caught off guard each time he's made an announcement?
I haven't been totally caught off guard in that we have studied the Reopening America plan and understand phasing, and we understand the recommendations in that plan. Also the Johns Hopkins risk assessment that goes along with rephasing. So I'm not seeing things that are foreign, but we don't know how each state is going to implement that generally until we actually see it come out of the governor's office. We do, in local public health, communicate with the Department of Public Health and Human Services, and the Department of Public Health and Human Services does communicate with the governor. It is largely indirect that happens. And in fairness to all, nobody knows what the future looks like. So with a disease with a really long incubation period, if you make a move too early, you are really just rolling the dice. You really, that time to try to watch what's going on is essential.
Thank you.
Any additional questions from members of the press?
I have a couple of questions, random ones that people have sent me. One is, what does half capacity mean in your mind? Is it half capacity of what the fire marshal says, or half capacity of what they would typically see on a normal day? And also, where do garage sales stand? I've had a lot of people ask about garage sales this week.
I think Shannon can handle that one.
Okay. So in the order, it really does say half of usual operating capacity. So it isn't meant to be the fire marshal capacity. I don't think very many businesses operate at their fire marshal capacity. But I think the 50% is there to really help encourage that there be social distancing, but that is the key. So the key is that you don't let so many people in your store that people are going to bunch up and scoot past each other and the lines are going to be long. And so people, I think stores have to figure out really what that is. So the 50% capacity is, I think, a lot harder, especially when you're looking at really big places. I think that Costco at one point limited it to 150 people within the store so that there was plenty of room between people. That both sounds like a lot and not hardly any at all. But so I think that really what the retailers need to do is look at how they can have people spread out in their space so that people aren't on top of each other. And really, as part of that, retailers are doing a lot to try to make that happen. And we need the public to be cognizant of those efforts and to not all go to the same aisle at the same time, and think about people who are waiting to get into that aisle and not just keep pushing past, because then it makes it really hard for the people who are trying to do the right thing to ever get into that particular aisle. We've heard some of those kind of complaints. And then the second question, Maritza, can you remind me what that was?
Yeah, it was garage sales. There are a lot
garage
of
sales
signs going up about garage sales right now.
Yeah, I think that based on the order that we have right in front of us now, where it limits events and gatherings to 50 people, what we would ask is that people who are working or who want to offer garage sales, it's not disallowed in the order or in the governor's directive, but just to think about, first of all, do not hold a garage sale if you are feeling unwell. And don't invite people to your space if you've been isolated or quarantined because of the disease or because you went out of state. Secondly, we don't want people to go to garage sales who are feeling unwell, have any of the symptoms of coronavirus. And then people, when you are holding a garage sale, you really need to think about the same kind of things. Make sure people can spread out. If you're going to garage sales, don't get too close to people. We encourage people to wear cloth face coverings. And then think about how you might be able to sanitize the items that you are buying, and understand that a number of people might have touched them. So we really encourage garage sales to have sanitizer available for people, but also to take your sanitizer with you. I know that it's not as easy to get as it was in the past sometimes, but it's important that we make sure our hands are clean before we touch our face again. And just a note about gloves, it's fine for people to wear gloves, but they're really the same as hands. So, you know, the disease doesn't seep through your skin. And so even if you're wearing gloves, you're going to have to sanitize those gloves and wash your hands. So that alone is not going to be what keeps you from getting the disease.
And I want to add a pitch, even if there's another question. I know we keep saying this, but it's so important. We get so many phone calls from people who are wearing their cloth face covering, and they're wearing it understanding that they're doing it to protect other people. The board took up the issue, and they are not reticent to make it mandatory. And some of the plans that we have to turn in, there will be areas where it's, you know, that will be part of the plan for these more tightly controlled settings. But we really would like to see more wearing of cloth face masks. There are people in the community that they're wearing theirs, but they're the high-risk person. And as we want to people to reopen, learn how to be safe, get more confident about that safety, and then truly reopen the local economy, that requires confidence. And for some people to have confidence, they need another person to wear a mask. That's what they need. They need the other person to wear the mask. So again, I recognize that this situation has brought a lot of hardships. I realize that some parts of my order today are welcome and other parts are not welcome. I absolutely recognize that, but what I have found through this whole thing is the majority of people want to do the best thing they can do to be safe and to support our local businesses and activities. And we are looking at what are the best pragmatic ways to do that. One of those is to wear a mask in public. The other is to keep being creative. The creativity that we have seen from the farmers markets, and that I think we'll see with graduation and some of the other things you've seen around the country, is a way to try to deal with the hardship of these mitigations without just opening up and then bringing on a whole new level of hardship in the form of disease or reshuttering of businesses. So I just really appreciate that we're mostly getting that type of sentiment. Keep that coming.
This is Ed at Montana Public Radio. Got here a tad late, my apologies. Cindy or Ellen, I'm not sure. Can you all talk about the testing capability in the county right now? And again, I hope I'm not making you repeat this.
Cindy.
Yeah, so right now in Missoula County, we have multiple locations that are able to do testing for people. We are now seeing supplies coming in at a pretty steady pace. I am optimistic that that will continue, and we will be able to test anyone who is having symptoms. We will also start to see some sentinel surveillance, and what that means is that through the governor's office, the state health department is going to be doing some sample testing of healthy individuals, just to see how many people are having asymptomatic coronavirus. So we don't know exactly when that's going to roll out. They're still in the planning phases for that, but we will start seeing that as well. So yeah, our testing capability has dramatically improved over the last couple of weeks. And at this time, we are able to test anyone who is having any of the symptoms of COVID-19. And in order to get that test, you can call your healthcare provider. You can go to one of the focus screening sites. All of that information is on our website. Or you can call us at 258-INFO and select option number 2 to speak to a nurse and get that appointment scheduled through our drive-through testing location, which is free.
Thank you.
This is Martin. I had one last question for Cindy, if I could. Or yes, Cindy, or anybody, Ellen. I know it's only May and the sun's out today and so forth, but most health experts have said that they expect this to return in the fall. I'm wondering what the local health department is doing, kind of looking forward and planning ahead for a possible rebound, come October, November, December. Will you stockpile supplies? Do you keep staff on board? I mean, what are you going to do?
I can speak to that, and then I'll turn it over to Ellen if she wants to add more to it. Right now, we are keeping all of our staffing on board because we do expect that we are going to start to see more cases as things start to open up. We don't actually know at this point if COVID-19 is a seasonal virus. It is quite possible that we could see more cases as we're opening up through the summer. So right now it's kind of unknown, but what we are doing is making sure that we're working with places like the schools that are going to try to plan to have students back in school in the fall, and making sure that people are really prepared and working with our healthcare systems, because we recognize that fall is also when we're going to start seeing the flu. And so we know that this could complicate our response to COVID-19 if we're seeing the flu and COVID-19 at the same time. And what we do know is that people can have co-infections, which means we could have more than one virus at the same time. So somebody could have a common cold and have coronavirus. Somebody could have the flu and have coronavirus. So we're definitely trying to make sure that we're working with all of our community partners to ensure that we are prepared if we do see a surge in cases. And Ellen, if you have anything.
No, you've got it. Thank you.
Ms. Leahy, this is Ed again. Am I wrong? You seem kind of pleased about this move right now.
Well, I'm pleased to be at a point where I feel like we've put some really good safety measures in place for those folks whose job requires them to be within the 6-foot contagion zone, and that is that personal care industry. The creativity and the ability to move forward on the farmers market. The high school graduation is, just another sad hardship. I'm pleased with the cooperation from those that in the school district that will have to make that work. But I do recognize that that is a really hard piece of news that I do take responsibility for. What I am pleased about is every time we've come up against something that's difficult, somebody has helped figure it out. And people have been willing to come together and to give. And the long view of, this can still come back. All the experts think it's not gone. So we'll go ahead and we'll be more careful. So I am pleased with that, because it's very, very hard to see the risk if it's not right around you and if you're not experiencing it. But pull back just a little way and realize how fortunate and actually how smart Montana has been with that early shutdown that really hammered this down. But in order to honor that and to keep that gain, we do still have to be very careful opening up. For the most part, people have been very, very cooperative and helpful in doing that.
Cool, thanks.
Okay, well, thank you everyone for joining us this morning. For members of the press, I will follow this up with a copy of the order, the attached appendices, as well as the news release. And I hope everybody has a wonderful rest of your Friday.
Thank you for covering us, Snooze. Thank you very much.
Thank you, guys.
Bye.
Thank you.